Also this morning here, today our state is reopened. It has been a very long year and 3 months under lockdown, and coming out of it, we wanted to check in with ourselves this morning. So fortunately, we've got Dr. Mauseth here to talk to us for this morning. Now, the doctor is co-lead for the behavioral health strike team for the State Department of Health, someone who was fully involved in the state's response to the pandemic. Hopefully can help us kind of get out of this here. Doctor, thank you for joining us. Good morning.
Good morning. Thanks for having me.
Absolutely. We appreciate it. So, doctor, let's talk a little bit about this. What is your main advice for people waking up today to a fully reopened state?
I guess my first piece of advice is to just recognize how it is that you're feeling about it. And it's normal for people to feel very excited. Obviously, there's a lot of opportunity that exists for us now that didn't exist even just a few weeks or months ago. But there's also a lot of folks who are feeling anxious and a little concerned about how it's going to go. Social relationships, family relationships, workplace changes. There's a lot of anxiety. So just recognize where you are and that it's okay to feel however you feel about it. And there's a lot of differences in how we're doing about it.
Yeah, and on that note, I mean, when we talk a little bit about anxiety, I was just kind of looking through Twitter today, and while a lot of people are really excited about reopening, I've seen a lot of parents specifically say things like, my kid's not qualified for the vaccine and we're reopening the state right now. How do parents kind of make sense of that? I mean, you are trying to protect your family while this is, also an exciting time. I mean, how do you make sense of that?
Yeah, I think one of the big things about coming out of any disaster is deciding for ourselves what we want to keep and what are the things that we want to let go. What did we learn about ourselves and what are the things that are really important to us? And boundaries are one of those things, whether that's work and home, whether that's mask wearing, whether that's social engagements, big gatherings, whatever you feel comfortable with. It's really important to recognize what your own personal boundaries are and to be respectful of those and to maintain them, and also to recognize that other people might have different boundaries than you do, but to make alternative plans and that kind of thing.
Absolutely. I mean, when we talk about boundaries and, coming out of this pandemic, I mean, could we see in the future all of us having some sort of PTSD? I mean, what does the future look like for our mental health?
Well, the good news is that that's not very likely.
Okay.
The mental health concerns that we're typically seeing with COVID are more related to anxiety and depression, which are certainly very significant for a lot of folks, but it's a different thing than PTSD. So the way that our lives have been impacted by this particular disaster is often a lot more subtle, even though some businesses and certainly some families and communities have experienced incredible deep losses. Mm-hmm. So there's a variety of ways that we are likely to be affected, but it still comes down to the number one most common outcome for any type of disaster, including a pandemic, is resilience. And that's one of the most amazing things about it, is that the perseverance and the strength that we've seen in each other and in our communities during this time has been really incredible.
Yeah, I think you're absolutely right about that. Certainly resilient after, everything is said and done. Doctor, I do have to ask you, we did a story today and it really broke my heart. It was about kids in high school and middle school, and it was some report that like out of 65,000 students surveyed, 60% of them or something had like real feelings of sadness and depression during the pandemic. Yeah. It sounds really like an epidemic. So if that is your child, how do you talk to them about that? How do you go about kind of righting the ship?
Yeah, it's a really big challenge. And there are a lot of youth that are really struggling significantly, not just in our state, but across the country right now. We need to check in with them. We need to reach out. They need connection. They need to engage safely in youth sports and being outside and finding ways to re-socialize with their peers, especially before we think about coming into a back to classroom setting in the fall. So really anything you can do to get kids involved in things, and then just to continuously check in, develop their sense of connection so that they feel like they're not isolated and alone. And if you do have concerns that you think are sort of crossing a line, don't hesitate to make an appointment with a primary care doctor or a pediatrician.
All right, Dr. Mauseth, thank you so much. It sounds like overall we need to give ourselves grace, our families grace, our neighbors grace as we, kind of start a new chapter here. We appreciate you joining us. Thank you.
Yeah, thanks for having me.
Absolutely.